approximately 4:08 p.m. The Personnel and Human Services Committee will come to order, please. Roll call.
Ryder?
Here.
Duransack?
Here.
Krieger? Begic? Coonan?
Here.
Lutz?
Here.
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 Warren present.
Let the records reflect that Commissioner Begic and Commissioner Krieger are excused, please.
Motion to excuse. Support.
Moved and supported. All in favor signify by the usual sign.
Aye.
Opposed, same sign. Carried. Public input. This is a time anyone here wishing to address the committee will come forward. Seeing none?
Minute. Pass the minute.
Oh, minutes. Minutes of September 19th, 2017. What's your pleasure?
Motion to approve.
Been moved and supported. Any discussions? Seeing none, all in favor signify by the usual sign.
Aye.
Opposed, same sign. We have minutes. Petitions and communications from the Health Director. Agreement between Bay County Health Department and My Community Dental Center for a dental center in Bay County. What is your pleasure?
So moved. Support.
Been moved and supported. Discussion. Seeing none?
I think this is a great opportunity for Bay County and the people that it's going to serve, because there's a real need out there. Tremendous amount of health problems that are generated from, having bad teeth. So I'm all for it.
Thank you. Any other discussion? Jim?
Yeah, I was just going to also agree with Commissioner Lutz on his assessment. The proposal that was drafted by the Director of Health Department is a great and detailed document that lays out a plan that I think would put Bay County in the forefront of expanding health services to our underserved. We would be able to provide dental care for thousands of people in Bay County at no cost to the county taxpayer. So it'll all be federal and state funded. So Director Strauss is here, and I just want to thank you for the work you've done. And I think a lot of counties would like to have similar programs of outreach to people who, as Commissioner Lutz mentioned, have dental issues that can lead to other more serious health problems if they're not addressed. Thank you, Mr. Chair.
Thank you. Mr. Coonan?
Thank you, sir. We must be providing some care to people in the dental needs right now, aren't we?
I don't believe the county is, but Joel, would you want to, I know we have a Medicaid clinic on Center Avenue that typically handles people who are on Medicaid, but I don't believe that we, and the Bay Health System does routinely have a bus that visits sites that provide on-site dental care. I'm not sure of the role
Yeah,
of the
there's,
county.
reading it's all kind of laid out in the proposed letter here. There are a number of different providers, a small amount of providers that focus on people with Medicaid or do not have insurance. Great Lakes Dental, or Great Lakes Bay, the FQHC here in town, formerly Health Delivery Incorporated. They do have a small dental facility and a dental bus that will sometimes go to schools and throughout the community. And there are some dentists that do provide services for folks with Medicaid or without insurance. But there is really a huge need, not only for these folks, the 19,000 folks that are on Medicaid, but you also have to remember the 20,000 folks that are on Medicare as well, because that's not a covered benefit unless you have supplemental insurance, which a lot of folks just can't afford. So we have, roughly 4 out of 10 people, 4 out of 10 adults that don't see a dentist on a regular basis. And we could go into the common effects that poor dental health has on physical health as well. So, MCDC has been in operation for over 30 years, and they have over 36 centers throughout the state of Michigan and a proven track record. So I'm very excited about this opportunity.
How many different locations in Bay County are they going to?
Just one, but it'll be a 6-chair dental center. In fact, I'm going to have Kim Singh, who's the Director of Community and Governmental Operations for My Community Dental Centers. She can elaborate more.
Again, we'd plan a 6-chair center if, again, the partnership proved that there were continued unmet needs. And again, at the direction of both the County Commission and the Health Department, we saw the need for additional centers, we would do that. But I think the initial plan is, as Joel indicated, a 6-chair. There's always a ramping up when you open a new center, so we'd start with a full-time dentist, hygienist, and support staff, but a 6-chair could support 2 full-time dentists as well as hygiene. At full capacity, that would probably serve 3,000 to 3,500 unduplicated patients, 8,000 to 9,000 visits a year. So again, we look forward to partnering, and again, as Joel indicated, also our ability we do provide a sliding fee scale, so we are able to provide services for the uninsured and seniors at reduced rates as well.
When's your projected opening for this?
We don't have a site targeted in yet. We again would consult with Joel and others, but I probably somewhere between best case scenario April, May of 2018 to June or July. So April through July, depending on site, the amount of renovation that would be necessary in terms of dental.
Thank you.
Commissioner Hare?
Let's just say 5-day-a-week operation.
5-day-a-week operation.
Okay. And so you would suspect, and you've obviously done this before, so you said you ramp up at first, as it will level off, and then, I mean, this, you know, so how many, this is like an 8 to 5 thing, 5 days a week, and do you hire a dentist, or do you get dentists on their day off?
All of our employees are dentists, hygienists, support staff are hired. We have currently in the 36 centers about 80 dentists, a combination of about half are full-time, and the other half might be retired, working in practice, part-time.
Okay, thank you.
And part of it, the ramp up, is really the energy that we can generate in the community from partners like DHS, behavioral health, you know, food pantries, senior centers, just to really get that word out
Right.
there.
Any further discussion? Seeing none? We have a motion and support. All in favor, signify by using your sign.
Aye.
Opposed, same sign. Carried. Thank you.
Thank you.
B, Director of Office of Criminal Defense, the MIDC Compliance Plan. Andrea?
Hello. I believe I just submitted an updated copy and a revised copy of my plan, but if I could just take a few minutes and kind of give a little background. Years ago, Governor Snyder developed and started the Michigan Indigent Defense Council, or Commission, in order to look at the state of Michigan and look at how indigents are getting defense and how we can improve, because nationwide, and especially in our state, there's a huge disparity in what kind of representation people are getting when it's free and provided by the government, and when they pay for it. And as you know, each county is, you know, tasked with the job of determining how and giving the cost, or providing the cost to give each indigent defendant an attorney. So that's when he started the commission, and the commission then developed these standards that they asked each county to look at and say, if we require you to meet these standards, what do you have to change? What do you need? And how much is it going to cost? That's what this plan kind of goes over. They are saying, we want you to look at the first 4 standards. What do you need in your county to get you up to speed on these standards? And how much is it going to cost? So they looked at what our county spent in 2010, 11, and 12 to determine a local share amount. Then by going through what we provide to our indigent defendants and what we still need to provide under these standards, we came up with a number. Now, what's important to note is that this is only going to be a requirement if the state gives us the money. So right now, everything is as is, and Bay County, compared to other counties in this state, does a wonderful job of representing the defendants that need free attorneys. There would just be a few things that we need to change, like arraignment attorneys, and at this point, I don't know that any county in the state of Michigan provides clients free attorneys at the time of arraignment, so we kind of added that cost in. And the other thing that was kind of a major thing that our county would need to work on would be the training of the overflow attorneys and the training of the arraignment attorneys if we were to get arraignment attorneys. It's also kind of important to note that this commission was started and before the Flint water crisis happened. So there was a lot of hopes that there was going to be money to be able to bring all of the counties up to these standards that this commission thinks every county should have. But I don't know where that money is going to come from. So again, these are just, it would just be our plan, what we would need to do, and the number that they would need to give us in order for us to comply. So it's not an unfunded mandate because we only have to comply if they fund it, which frankly at this point, I don't know that they have that kind of cash around because it just isn't our county, it's every county across the state of Michigan. And I mean, you're looking at Wayne, you know, Oakland County, a lot of big counties where you're talking millions of dollars.
Commissioner Herrick?
No, I believe Muskegon County does this, right? Are we the only ones who are doing this right now that have this in place?
Have what in?
The Indigent Defense Council that has, and this plan, you know, like we have, you know, you and your group there, and Muskegon County has it, no, or nobody else?
Every county in the state of Michigan has to develop a plan and submit it to the state by November 20th. If the plan is not submitted November 20th, the state will come in and hire somebody to develop a plan and then charge the county to do it. So every single county across the state of Michigan is doing this. And actually, it's not even only counties, separate little jurisdictions, because you're talking in Wayne County, there's a lot of different courthouses and a lot of different kind of subgroups that they look into, and they have to develop a plan for each one. We do have an MIDC representative, Barb Klimaszewski, that I've been working closely with, and she does counties all over the state. So Huron County, Saginaw County, Midland, all of them have to submit these.
But how many of I think I get that part, but my question is another county, are there any other counties in Michigan that are doing what we're doing right now?
As far as having a public defender's office and an office of criminal defense, I believe Washtenaw County does. I believe, and if I'm correct, maybe Berrien County does now. They were, and the reason they have one now is I believe that they were sued a lot because the representation that the people were getting was so subpar that it was costing the county a ton of money, and it just kind of...
And my last question, I'll let somebody else ask a question. Were there these compliance plans, so you said this one is due in November, is there is it going to be like one every 6 months, or is it every year, or how is that going to go? This is a compliance plan, right?
This is the compliance plan for these first 4 standards. So at this point, this is as far as the commission has required us to go.
There's only 4 standards right now?
Those are the 4 standards that they're requiring us to do a compliance plan for. There's several other standards, but they were going to put them out in waves. And I think part of that was, are we even going to be able to get funding for these first 4?
Okay, thank you.
Commissioner Kuhn?
Thank you, sir. Look, I just got the plan. It looks nice. You must have worked with, was it Barb, to put this together?
Barb Klimaszewski, yes.
Yeah, and it looks good. And, you know, we don't know if we're going to get funding or not, but I think what we did by taking all indigent counsel in-house as opposed to contracting out, I think that has helped. And I'm asking you, how is things working now since we changed from contracting out lots of it to doing most of it in-house?
And I'm glad you asked that question. Our office is running very smoothly, and I'm not going to disparage the contract attorneys at all because they're very, very good attorneys. But I've been keeping in contact with the judges and the judicial staff to see how they feel about everything and how they think it's going, and we've gotten nothing but compliments. We haven't gotten any complaints. And we've kind of been doing some things that maybe weren't always done before, like, for example, and I know the jail knows this, but after 28 days, if you're held in jail on a misdemeanor, you should be given bond unless there is a really good reason why you shouldn't be. Well, some people were staying in jail 50, 60 days just because nobody had brought it up. That cost the county a lot of money. So we're starting to keep track of things like that, kind of looking at, okay, we were able to kind of pin on our calendar, okay, this person needs to get out of jail at this point, and look at the cost savings of when we can get them out of jail and when their next court date was, and how much are we saving the county there too. So I'm incredibly pleased. I think we have a wonderful staff. The attorneys that we hired are great, and I've gotten no complaints.
So whether or not the state gives us any money for this, I think, and we've been working on this, and you guys have been working on this for years, so that we have done something good for people.
Absolutely.
The poor who need representation are probably receiving quality representation now. So if the state decides they're not going to implement this, we're still doing something positive for those folks.
I do truly believe that, and we make sure that they're trained, and being in-house, we have the ability to also have contacts with other services, like the health department. You know, we can say, oh, look a little bit more into their social issues that they have, because a lot of times that's the huge issue with people. Health, education, unstable living environments, and we're able now to have access with that information and kind of steer these people in the right direction and hope that we can get them to a place where it's not a revolving door. It's kind of social work / lawyering.
Good job.
Thank you.
Commissioner Grant?
Thank you, Mr. Chair. Construction costs, are they, I don't really see them in there, like for remodeling to get this set up, or?
Based on the plan that I have developed, I don't think there would need to be any construction costs. We've already done the construction, separating the two offices. The main part of the plan is bringing in arraignment attorneys, and we have a lot of attorney conference rooms at the courthouse right now. And because the arraignment attorneys would be contract attorneys, they would be responsible for either utilizing those rooms or their offices. We also have a lot of availability at the jail as well, and I think it included things like a polycom and a deputy to help with transportation for that. So we're able to keep the costs at a minimum, because let's say they do approve this plan, they're going to really be looking at it with a fine-tooth comb, because a lot of counties are using this as an opportunity to try to get things that maybe don't have any relation to indigent defense. So as much as I would like to add a lot of things in there, for the county, we're just not able to do that. And that's kind of one of the reasons we went through Barb Klimaszewski and her boss to review the plan before I even submitted it to you, because I don't want it to get kicked back to us.
Thank you.
You're welcome.
Commissioner Hare?
I just want one more comment, and that's, a lot of people don't realize that the cost, one of the things you mentioned, the people being in jail for too long, and the cost of housing an inmate for one day, and, in the state of Michigan and everywhere else, we pay more to take care of inmates than we do to educate our children. And I think that's a significant savings right there. I think that's a really important point that you made. Now I provide good counsel, but to make sure that, that they're not using a space, they don't need to be there. We're talking about, mostly folks, like I said, misdemeanors, they shouldn't be in jail for longer than that. And I think that's a great point that you made.
Thank you. And we do feel like, especially that we have something to prove with this office, we want to make sure that everybody's getting a fair shake, but also that we're not, it's not a money suck for, the county, and how can we save costs? And that's one of the things that we're trying to keep track of, is where are we saving costs for the county and how much does that cost? So thank you for that.
A motion is in order.
So moved. Do we make the motion yet or no?
We haven't made a motion yet. So
Support.
been moved and supported. Any dis-
Yeah, Mr. Chair, if I could, in addition, I know that there's a special board meeting directly following this. There is a compressed timeline in order to turn in this plan. I did not know if it would be possible for the board to refer this matter as well to the special board meeting directly following this one for final passage.
Move to refer.
Support.
Been moved and supported to refer. Any discussion? Seeing none, all in favor, signify by the usual sign.
Aye.
Opposed, same sign, carried.
Thank you.
Thank you, Andrew. C, from the Personnel Director, we have vacancies under 1A, Correctional Facility Officer, and B, Road Patrol Deputy. What is your pleasure?
So moved.
Support.
Been moved and supported. Any discussion? Seeing none, all in favor, signify by the usual sign.
Aye.
Opposed, same sign, carried. Under C, a Records Specialist Leader. Tiffany, would you care to address that at this time, please?
Yeah, thank you, Mr. Chair. In speaking with the Sheriff's Department, I would like to amend the resolution to request up to 4 weeks of training. The person who's leaving is retiring because this position is who works on the lean network that has a lot of rules, regulations, and some pretty stiff penalties if something is done incorrectly. We are asking for a little bit of cross-training so that the county doesn't get themselves in any hot water in not using that correctly.
So moved. Support. Any discussion? Seeing none, all those in favor signify by the usual sign.
Aye.
Opposed, same sign, carried. Under 2, Department on Aging, we have in-home worker, part-time, and a driver, part-time. What is your pleasure?
So moved.
Support.
Been moved and supported. Any discussion? Seeing none, all in favor signify by the usual sign.
Aye.
Opposed, same sign, carried. 3, under Equalization, Appraiser Aide, full-time. What is your pleasure?
So moved.
Support.
And moved and supported. Any discussion? Seeing none, all those in favor signify by the usual sign.
Aye.
Opposed, same sign, carried. Under 4, Buildings and Ground Custodian, full-time. What is your pleasure?
Support.
Been moved and supported. All those in favor signify by the usual sign.
Aye.
Opposed, same sign, carried. Under D, Office of Assigned Counsel, August 2016 report.
Motion received.
Support.
Been moved and supported to receive. Any discussion? Seeing none, all in favor signify by the usual sign.
Aye.
Opposed, same sign, carried. Under E, from the purchasing agent, a replacement of Center Ridge Arms parking lot waiver of purchase policy. What is your pleasure?
Support.
And move and supported. Any discussion? Seeing none, all those in favor signify by the usual sign.
Aye.
Opposed, same sign, carried. We have a resolution before us today, Resolution 2017-232. I would ask our Drain Commissioner to speak on this resolution, if you would, please. Joe?
Thank you, Mr. Chairman. It's a simple waiver, I guess, to allow GIS information to be utilized by our consulting engineer on a drain project, the Hopler Creek project. Obviously, any data we provide them is a cost savings to that drain district and the residents in it. So it's just a simple use of some GIS to ensure the drain district lines are as they're supposed to be.
Thank you, Joe.
Motion approved. Support.
We're moving supported. Any discussion? Seeing none, all those in favor signify by the usual sign.
Aye.
Opposed, same sign. Carried. Is there any referrals? No. Any unfinished business? New business? Miscellaneous? Announcements? Motion to adjourn is in order.
Motion to adjourn.
Moving supported. All in favor signify by the usual sign. Opposed, same sign. We are adjourned.
It's 4:33 on Tuesday, October 17, 2017. And I'd like to call the meeting of the special meeting of the Bay County Board of Commissioners to order. Could you take the roll, please?
Begic.
Excused. Coonan.
Here.
Ryder.
Here.
Lutz.
Here.
Durancheck.
Here.
Krieger. Herrick.
Here. Motion to excuse.
Commissioner Krieger and Commissioner Brigade.
Support. All in favor?
Aye.
Opposed? Motion carries. Oh, invocation, please.
Eternal Father, you have placed us in a world of space and time. Through the events of our lives, you bless us with your love. Lord, we ask that you will grant to this Board of Commissioners and all those in authority patience and understanding to work together for the good of all people. In your holy name we ask this. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
At this time, if there's any citizens who would like to step forward and speak to the commission, now would be the time. No one from the audience? And we'll move right into items for consideration. First is resolution number 217-30-2017, apportionment from the Equalization Department.
So moved.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries. Then we have resolution number 2017-231, the waiver of a purchasing policy for the replacement of Center Ridge Arms parking lot from Building and Grounds.
So moved.
Support.
Discussion. Commissioner Coonan.
Well, I just want to go back to the previous one. Kelly, somebody asked me if there were two millage proposals for the care facility.
There's only one
Just one?
for the .75 mils.
All right. And thank you very much. I'm just looking at it now, but I don't know why they said they opened up their ballot and there was two. But maybe. Go
Mr.
ahead.
Redmond. You have a
Well,
question?
they were getting half a mil, they're upping it to 7.5 and increasing it by one more year. The reason, matter of fact, I suggested increasing a year because they did, that's why the election is in 2017 and we're trying to have everything on even numbered years. So they're adding a year to it too.
But there's only one question.
One question.
Okay.
And it was not an increase from last year. It was .75 last year.
All right, thank you.
Okay. Okay, on the Building and Grounds, we have a motion and a second. Any more discussion in the parking lot? Seeing none, all in favor?
Aye.
Opposed? Motion carries. Next to Commissioner Ryder, Personnel.
Thank you, Mr. Chairman. We have resolution 2017-232. I would move that resolution forward.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries.
And finally, we have resolution 2017-233. I would move that resolution forward.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries. Thank you, Mr. Ryder. Do we have any unfinished business? Any new business? Miscellaneous? Announcements? Oh, Commissioner Coonan.
Well, I don't know if anybody saw 60 Minutes on Sunday. You know, we've had all this discussion with the Sheriff's Department on this opiate crisis, and people, 20,000 people die of overdoses, and I don't know how many other families are impacted by it. But, you know, when you watch that and you see what took place, it was legislation that was drafted. Now, Jim, you know this better than I do. And it went through the House without discussion, went to the Senate without discussion. And it was made into law where these drug manufacturers can more easily dump their pills anywhere. And you had these pain clinics popping up all over. Now, people should be looking at this and saying, what are these guys doing here in Washington? You know, it's all being done, you know, and then Trump
nominated this guy who drafted the resolution to be the drug enforcement czar. Now, people are not comprehending what's going on. We've got a major problem. We need to be, and hopefully if somebody's watching, you know, I know, even if I have to talk to just to this small group, I will, because things aren't right there. Hopefully, we will use that as a tool or as an opportunity to talk to our friends, our family, and to get people to start thinking about what's going on and how this country is being legislated or not legislated, and how we need to change things. So, and I know, Jim, it looks like your hand's up, and you're probably going to add something a whole lot more.
I just know, I'd like to add to your expressed concern, Commissioner Coonan, about what is really a nationwide epidemic of opioid abuse. And the 60-minute special, if those of you can have an opportunity to see it, would Google it or somehow access a recording of it. It was very enlightening. Pain clinics in Florida would have people from West Virginia and Ohio travel all the way to Florida and get thousands of pills, where they return back to their home states, sell them for between $5 and $8 per pill. They're highly addictive, especially the OxyContin. And I'm very proud of the fact that our board supported our effort, and also Andrew Johnson's work with the law firm out in New York City, so that when a settlement is made, and we believe it will be, it's just a question of when, the Bay County taxpayers will be able to recoup some of the expenditures that have been made in dealing with this. The courts, our law enforcement, the Bay County Sheriff's Department, our Medicaid costs that have been excessive because of opioid addiction, not to mention, of course, the suffering and emotional loss of families that have had members that have died of overdoses. And so I know that the County Executives of America have retained the same law firm, which we saw a few weeks ago, I think, on Skype. And they were the lead firm suing Big Tobacco. And I think this is very similar, and they're going to do under the RICO statute, racketeering. And they have quite a bit of extensive research that's already been done in terms of people who have knowingly contributed with physicians, pharmacies, and pharmaceutical companies to the proliferation of long-term opioid use, which then evolves into addiction and then into other problems, sometimes going to graduating to heroin or whatever. But I do want to thank the board again for your support of Bay County being included in the class action lawsuit, because that will open the door for Bay County to recoup resources that we've expended dealing with this difficult problem.
Thank you. I agree with both of you gentlemen, and if people were smart, they would tune in to get on YouTube and go to the 60-minute special from 10:15-17. It was pretty enlightening when you see some of the stuff that's going on, and you know, especially the pill mills. It's like you talked about. It's scary, is what it is. You know, we gotta, not only for adults, but we gotta be scared for our children too, because it's out there and it's all over the place. So hopefully something will get done about it. Thanks. Any other announcements? None. Do we have a need for closed session yet?
I'll have one announcement. Debbie Russell has a little illness and she couldn't be with us today at the meeting, but I did want to commend her and Manager Mike Halstead and the dedicated staff at Animal Control. We had another Clear the Shelter event last Saturday, and I believe, I'm doing this from memory, but 19 dogs and 42 cats were adopted. Wow. And the shelter was cleaned out, and no adoption fees. They were all vaccinated with their shots and all neutered and spayed, basically at no cost to our Bay County taxpayers through our support and the grant from All About Animals.
Great program.
Debbie Russell has really, working with Mike Halstead and the dedicated staff there, I have to compliment her for the tremendous job that we're seeing in reducing significantly the euthanization rates for our dogs and cats at the Animal Control. Just thought I'd make that announcement.
We got her. Need for closed session, ma'am.
Yes, Mr. Chair, on behalf of the Personnel Director, I would request to go into closed session pursuant to MCL 15.268, Section E, to consult with its attorney regarding trial or settlement strategy and pending litigation on the Van Ness matter.
Need a motion?
So moved.
Or discussion? None. All in favor? Oh, roll, please.
Begic. Coonan.
Here, yes.
Ryder.
Yes.
Lutz.
Yes.
Durancheck.
Yes.
Krieger. Herrick.
Yes. We will now go into closed session. Could you take care of the doors? Commissioner Durancheck. Hey. Would you like to begin, ma'am?
Yes, thank you, Mr. Chair. I would request a motion to approve and accept the attorney's recommendation for settlement.
So moved.
Support.
Discussion. Seeing none, all in favor?
Aye.
Opposed? Motion carries. Is that all our business, ma'am?
As far as I know, Mr. Chair.
Thank you.
Motion to adjourn is always another report.
All in favor? Motion carries.